health and prevention and promoting health here in Cotuí County. We, as CDC, during COVID, put $30,000 US into creating an emergency operations center that really, again, is about preventing, detecting, and responding to disease threats. One of our big programs that we do in Cotuí County is with the President's Emergency Plan for AIDS Relief, PEPFAR, which really does HIV and TB prevention and care and treatment. So we work to make sure that everyone living with HIV is aware of their diagnosis, that those who are HIV positive, those who are living with HIV, are on life-saving treatment. And those on life-saving treatment are really virally suppressed, which means they can't transmit the virus to other individuals. So we work in partnership with Cotuí County and with our implementing partners to do that work. We also work to really strengthen health systems. So monitoring and evaluation, human resources for health, laboratory work, to make sure that the systems are in place to have strong programs. In the last 3 U.S. fiscal years, CDC has supported Cotuí County with $6.4 million US as part of the, most of that being the PEPFAR program, but also global health security to do the work that I was just discussing. And for the first time in January 2023, for the first time, we started funding directly Cotuí County with about $110,000, which, I'm going to get this right, and shillings is about 13 million shillings. And we're really hoping to grow this partnership with Cotuí County because what we're looking for is to have a program that's more sustainable. When PEPFAR started, it was an emergency plan. People were dying of HIV. We didn't have good life-saving treatment. Now we do. And we are into a new phase of PEPFAR where it's more manageable, and we're really close to epidemic control in Kenya, where most people know that they're living with HIV, they're on life-saving treatment, and they're virally suppressed so that they're not transmitting the virus to others. And it's become much more manageable. So now we can have individuals working in different models that maybe aren't quite as expensive and are better for the people themselves. So they don't have to come quite so often to the health facility to get their treatment. They come maybe once every 3 months or once every 6 months because they're very stable. And so what we want to work towards is finding really sustainable ways for Cotuí County to own the HIV response. We know we have incredible technical expertise. We've seen we have very good political support here. And so the next steps will be for what can be done so that Cotuí County can really lead this response, including eventually funding the response on their own. So we've had a very good discussion here. I really want to thank His Excellency. I think we will be continuing forward to very collectively work together to make sure we continue to move forward in Cotuí County. And I'd like to maybe turn it over to some people who can really speak more eloquently about the county and the work that they're doing here and some of the milestones that we've already reached here and the successes that we've had.
Thank you. We'll give a shilling as well. The President himself assured us when we were in Naivasha on a Friday and Saturday last week for the summit. So that will be done, and this program will be sustained in this county, and I want to give my assurance as a governor that we will make sure money is allocated for the program. We'll make sure that the 146 plus 46 elderly workers whom CDC and the other partner has enabled us to recruit, they are sustained even beyond when the two organizations will disengage. The County Public Service Board was involved in this process, and they delegated the power to recruit the 146 plus the 46 to the county or the management team or to the CEO. So it has been done as per the required regulation. So there will be no issue or no talk of now they are supposed to quit or to be sacked because they were not properly recruited. So wherever they are, let them be assured we require their services, we support them, and we want to continue working. The money which CDC is giving us is from the people of the United States of America. When you are away, Dr. Jennifer just told us the President of the United States of America, President Joe Biden, when he was delivering his State of the Nation address, probably the most important address any president delivers to his people. In South Africa, President Ramaphosa was delivering one there just a couple of days ago. Here in Kenya, I think around March, February, April, the President Ruto is supposed to deliver one. And if your program gets a mention, just 3 words, in that speech, particularly positive mention, and this program was positively mentioned by President Joe Biden because of the good work which CDC is doing in Kenya and even in other parts of Africa. That is very positive because it means continued support, continued engagement, because there has been accountability. So in our case, we will have accountability. There is a special account where the money for the program goes, and it is accounted properly. We have our Minister for Finance here, whom we have invited to this meeting because matters finance in the county is responsible to ensure even the accountants in the Ministry of Health, they ensure the money is properly accounted. The officers, the health officers, public health officers, mainly, they also utilize the money properly, and the procedures for disbursement, procedures for accounting for the money are adhered to. Thank you very much, and I would like to take this opportunity once again as you conclude to thank the CDC team for coming over for the courtesy call and for us to renew our partnership, and they've come at the right time because it's this transition time. You know, just Monday and Tuesday we had the pharmacy, the outgoing, they have left the former, let's call them former CEOs, former minister, they have left, but there was very smooth handing over which was not done before, and it probably has not been done in many counties. We did not want to chase anybody, but we wanted what we call seamless handing over. That was done, and therefore this courtesy call came at the right time when the new team had just come in. I requested them to delay the reporting to the Kenya School of Government. You know, all the CEOs, all the ministers, the new ones, were supposed to report today. The others are already at the Kenya School of Government, Lower Kabete, for the induction.
Government to this program in areas of human resource, continuous capacity building, system strengthening, so that the project can continue. So in partnership, we will also be looking at various models which work for our context or which can work in Kitui County. Is it integration, or what model can we implement such that we make service delivery in terms of HIV and TB care cheaper or easier to deliver to our people? We've already started with the community health volunteers. This is not a new program. It has been there, but it stopped at some point. And therefore, the community health volunteers are being reinstated, which are very key in this program. And they will start talking to our people from household level. We have a total of 2,470, 10 for each village, county villages. We have 247 of them. And so we will be working with them as we continue partnering and seeing how we can sustain this program for our people. Thank you.
Thank you.